what I want to emphasize is that these conditions aren't as complex as they may seem on the surface. I mean, they are complex in one way, but another way, if you step back and look at the fundamentals of how the body works and how the body responds to nutrition, medications, or the like, this can help you address these problems in a more straightforward manner.
Miss J, she's an 85-year-old female. She has history of atrial fibrillation, ventricular tachycardia, defibrillator, heart failure, COPD or chronic obstructive pulmonary disease, secondary to chronic lung infection and some multiple PEs or blood clots in the lungs. She's had a lot go on and a lot of inflammation with her heart and lungs over time. And she's on portable oxygen. She had come to our clinic after not being here for 3 months, and she had reported more fluctuations in her heart rate that she was noticing, and sometimes more dips in the blood pressure. She would have more episodes of weakness and dizziness. No fever, chill, no pain with urination, no increased sinus problems, actually. But when I saw her today, I was like, we need to recheck pretty much everything. We need to check her thyroid, make sure she's not anemic, recheck the pumping and structure of her heart, and check if she's going back into more arrhythmias. One thing from her history that she was put on a new inhaler for her lung disease. A new type of inhaler that combined 2 medications, and those medications can trigger more arrhythmias. So that was one thing.
How long ago was the new inhaler started?
A few weeks ago.
Okay.
So it was a Nora, which is a combination of anticholinergic and a beta-2 agonist. So they can increase atrial fibrillation or tachycardias. And so on our EKG today, it was more irregular, more like a multifocal type of arrhythmia, not true atrial fibrillation. But I told her, let's put an external monitor, take a deeper dive, and did very comprehensive blood work. And then wanted to talk to you about her new inhaler for her COPD, because she is dependent on oxygen, and wanted to see what your thoughts were about getting off that inhaler, talking to her lung doctor. I didn't stop that inhaler yet because I don't know the recent findings of any lung testing, and I wanted to make sure other causative factors of increased arrhythmia weren't at play. Like, she's had a UTI in the past that threw her heart rhythm abnormal again. Wanted to make sure she wasn't anemic, wanted to make sure it wasn't a thyroid problem. She does take a medication to help with arrhythmia called Soltalol, but I have to be very cautious. If I increase it, it could lower her blood pressure more, and that her blood pressure runs on the low side. So
this interesting patient, or A's, with significant lung disease, the heart disease, arrhythmias, and we've been taking care of her for a long time. And the lung issues are multifactorial. There's some chronic lung disease. I think there's a chronic inflammatory component to it, and we've been addressing that. It's always been my take, if we be very aggressive with the anti-inflammatory component, we can get all this under control. She did well with ozone infusions in the past. She's been reluctant to repeat it for, I guess, different reasons. Also, I think liposomal curcumin has helped. Serrapeptase has helped her before. So we've done well with her with this regimen. Now, my recollection, the last time I saw her, maybe a couple months ago, she was relatively stable. I don't know what prompted the need for the new inhaler. Did she have more symptoms or hospitalizations or exacerbations or what?
More weakness, shortness of breath, not another hospitalization. The other thing was she was on high dose of some anti-inflammatories like curcumin, serrapeptase, and like a sinus rinse with the liquid advantage, kind of an pathogen natural supplement.
I remember we saw that. Now, she was having some sinus congestion. She said that had improved.
That improved, and that's still improved. So she doesn't use the nasal wash as much, but with her 3 anti-inflammatory supplements, on 2 of them she went down on the dose some, just on her own, for just reasons of obtaining it, right? So that could be a factor. If she went down on her anti-inflammatory supplements, could that have triggered the need for another medication from her lung doctor? You know what I mean? But that could be it. So I told her to go back up on the higher doses, but still wanted to check other causes too, at her age, you know.
And did she notice symptoms of palpitations since being on the inhaler? How did she feel before and after the inhaler?
The most of her problems were after the inhaler. So
They are what?
they're more the weakness, the palpitations, and
Shortness of breath?
the shortness of breath. That was a little before and after.
She's basically remained short of breath and picked up 2 more symptoms.
Correct, because we put her on our oxygen when she got here.
So based on that assessment, what should we do with the inhaler?
Probably put a hold on it. Yes. Because, I think
It's not making it better.
causing,
It trigger other
right,
It's making things worse.
and
And plus you have an arrhythmia.
Right.
Now the arrhythmia could also make her what?
more short of breath.
Yeah, and what else?
More
pop-
weakness and tired, yeah.
So here's a situation where you have a patient with heart disease. Now, let's talk about the heart for a minute. Heart's a pump, as you know. It has to work efficiently. It contracts, relaxes, contracts, relaxes. Blood circulate from upper chambers to the lower chamber, and then out of the heart from the left side goes to the body, from the right side goes to the lungs. The efficiency of the pumping of the heart is important for the efficiency of the circulation of oxygenated blood to the body. If the heart doesn't pump efficiently, it doesn't circulate blood efficiently, it doesn't circulate oxygen efficiently. If the heart doesn't circulate oxygen efficiently, then you can become more short of breath, you become more fatigued, okay? You have chest pain, you have lots of symptoms due to poor efficiency in the circulating blood. So she was more fatigued, shortness of breath did not get better,
Right,
and then she had new onset palpitations.
correct.
So the palpitation are likely related to abnormal heart rhythm, the atrial arrhythmia. So what a abnormal heart rhythm does to the heart, it makes the heart beat less efficiently. When the heart's contracting in order and rhythm, it beats efficiently. When things are out of order, it beats less efficiently. When it beats less efficiently, there's certainly blood less efficient, oxygen goes to body less efficiently. That makes you tired. So what the inhaler did, which is supposed to treat the shortness of breath, it didn't really do anything for the shortness of breath of significance. But what it did give her a side effect of an atrial arrhythmia. The atrial arrhythmia caused the heart to beat less efficiently. When the heart was beating less efficiently, it circulated blood less efficiently. When it circulated blood less efficiently, she became more tired. And because of arrhythmia, she felt it because the heart was beating and she felt palpitations.
Right.
So the medication brought on problems. It did not resolve problems. And the reason shortness of breath may have persisted or progressed may have been the fact she decreased the anti-inflammatory supplements. Our favorite increased anti-inflammatory supplements. Maybe there are some other things we can do. Some people do hydrogen peroxide inhalers in case there's like a lung infection. So that can help out and other things like that. But I wouldn't add an inhaler to someone with arrhythmia like this. We'll tell the patient to stop the inhaler.
Correct.
So again, another situation where you have to look at the total patient, you have to look at the medication interacting with the patient, and you have to look at other side effects. And the symptoms of fatigue gets to, well, why is she fatigued? You have to look at disease mechanism. And so if the heart's not beating efficiently, she could have chest pain. Okay, that could be a symptom related to the same thing I just said.
Right.
Okay,
Yeah.
so that's why I would say that I would hold the inhaler Give her 2 more weeks. If she's better, then you know something. But I think we know something now.
Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.